Hi, my name is Dr. Bogofanya Amadasu, and today I want to talk to you about nasal allergies. An allergy is just your body overreacting to things in your environment, usually things that have some little degree of protein in them. And they can range from dust, and it's not the sand in the dust, it's actually the particles from dead insects, dead greenery, and all that are in there that give rise to these allergic responses. So, how do you know you have a nasal allergy? What makes you think or suspect a nasal allergy? One of the commonest signs is sneezing. That you wake up in the morning, you're sneezing, you walk into some rooms, you start sneezing. People tell you they even just pour cold water on their bodies and they start sneezing, or the room gets too cold, they start sneezing. But sneezing is one of the common complaints when you have nasal allergies. And with the sneezing comes watery catarrh, or what doctors call watery rhinorrhea, that you start producing a lot of mucus. And that's because the body is trying to wash away, or the nose rather, is trying to wash away whatever entered it that is causing you to have a nasal allergy. When after that, you now start noticing that your nose feels stuffy, sometimes completely blocked. Okay, and this blockage can alternate from one side to the other. That's the usual picture you have, that the left side is blocked now, later the right side. But there are other things that will make us suspect that you have an allergy. Your eyes. If you have itchy, watery eyes along with all this sneezing and all, most likely it is an allergy. Then some people, they have some of these symptoms but not the others. But if you look at them around the eyes, even little children, they have these black eyes, and they have these bags under the eyes with this crease on their nose because they keep on doing this. We call it the allergic salute, that the person is constantly rubbing his nose. It's called the allergic salute. And these black eyes. So if you're having all these things together, you most likely have a nasal allergy. Some people also have this that happens in their throat, because the throat is also involved in nasal allergies, because the mucus, excessive mucus, drains back into your throat. Not all of it comes forward, and you keep having to clear it, and you have to make this lovely noise that I try to make sometimes, but I never succeed. So all these are signs of nasal allergies. What can you do to simply manage them? Over the counter, we have the anti-allergic drugs. Over-the-counter anti-allergic drugs. They're over-the-counter drugs that will dry up their noses. Those are the simplest measures. But if your allergies are there and they are not responding to all this, and it keeps happening over and over again, it's best you see your ENT surgeon.